Victoria Flint, Skills Video, Vet 121. Surgical hand scrub using a wireless antiseptic. In this video, I will be showing how to properly scrub using AvaGuard. Wireless hand antiseptics are now available that are at least as effective as a traditional hand scrub method. These antiseptics contain alcohol solution, which provides a rapid antimicrobial kill of a broad spectrum of microorganisms. They also contain lotion to prevent drying of the skin. Hands must be clean and dry, but scrubbing is not necessary. The solution is rubbed briskly and evenly over one hand and forearm. A second application is applied to the other hand and forearm. A final application is applied to both hands and is allowed to air dry. The wireless antiseptics are fast, effective, and easy to apply and non-irritating. Open gloving. The glove pack is open near the edge of the table. The hand is inserted into the glove opening, taking care not to touch the outside of the glove. The inside of the glove will not be sterile, so the cuff may be touched. The glove is pulled by grasping the cuff fold with the other hand. The cuff will be folded, but the glove is on well enough to allow use of the hand. The gloved hand is placed between the cuff and the palm. The glove assists gloving the other hand. This protects the gloved hand from accidental contamination on the arm. The cuff can be unfolded. Now adjustments can be made to both gloves, taking care not to touch any of the sterile areas of the glove. Gowning. The gown is picked up in its folded state. Move to a spacious area to reduce the risk of contamination. The gown is held away from the body by the inside shoulder seams and allowed to unfold. The arms are slid into the sleeves, but the hand should not extend through the cuff openings. Closed gloving. The sterile pack is close to the table edge so that the surgeon can remain some distance from the table to prevent contaminating a sterile gown. The sterile paper wrap containing the glove is unfolded and one glove is picked up. It is easiest for most people to the glove to be their non-dominant hand. The fingers must be kept inside the sleeve at all times during closed gloving. The glove is laid on the hand to be gloved with the glove fingers pointing towards the elbow and the glove foam laying against the sleeve. The edge of the glove cuff is grasped through the gown sleeve. The opposite side of the cuff is grasped by the other hand. The glove is pulled over the hand. Now the gown and cuff may be grasped together to pull the glove completely into the hand. The assistant decides which instruments from the pack are required by the surgeon and the surgical assistant for the procedure and places them according to the surgeon's preference. Instruments not required for the procedure on the back side of the table, instruments directly required by the surgeon such as scalpel, Mayo, and Metzenbaum scissors on the surgeon's side, and instruments and material typically handled by the assistant such as suture scissors, sutures, needle holders, hemostats on the assistant's side. To be truly efficient and effective as a surgeon assistant, the veterinary technician must be familiar with the procedure performed. Here we are doing a canine neuter. When passing instruments, the assistant should firmly snap the handle or handles into the open palm of the surgeon. This keeps the instrument firmly under control and position for use. When the surgeon is finished with the instrument, it should be quickly wiped clean off blood and tissue and returned to its position on the instrument stand. Prolonged soaking of instruments in water should be avoided because it ultimately causes corrosive damage to the sharp cutting edges and hinges. Assistants still move around to open instrument packs to adjust table height or adapt to antiseptic equipment. Communication is important and position changes should be announced. The gowned and gloved sterile surgical team should primarily face the sterile field and must not touch or bend over non-sterile regions. In a few areas of this video, I do throw stuff away in the trash and break that rule. The back of the gown is always considered non-sterile, and the front of the gown extending from far below the shoulder level to the level surgical field is considered sterile. Therefore, the assistant's hand must be positioned above the waist and below the shoulder. The sleeves of the gowns are considered sterile from 5 centimeters above the elbow to the level of the cuff. Clasping hands in front of the body is recommended, or the hands can simply be rested approximate to the incision site and ready to assist. Unnecessary traffic and visitors in the surgical suite should be avoided, not only during the procedure, but at all times to help control dust and contamination of the facility. You will notice one time in this video, a technician comes in because the patient's vital signs were abnormal and the anesthesiologist wanted a second opinion on the patient's condition. Being that this is just a canine neuter, there's few things I actually assist the surgeon with besides handing him his instruments. There are a few occasions where I will use sponges to help control the bleeding. The sponge should be applied with a blotting type of motion. A wiping motion will irritate the tissue and often renew bleeding by pulling foreign blood clots out of incised capillaries. The pressure apparently stops hemorrhage by collapsing the vessel under clotting can occur. With persistent hemorrhaging, pressure may be needed to be sustained for up to 5 minutes to allow adequate coagulation. It is very important to know how many sponges are in your pack, especially with abdominal surgeries where they can easily be lost in the abdomen and suture up. Sponges left in the body after closing of the incision will cause severe inflammatory reaction, adhesions, and drainage. The abdominal and thoracic cavities are particularly hazardous locations for sponges to become lost. Consequently, many surgical assistants count sponges in such areas to make sure all sponges have been removed. Before surgery begins, sterile sponges are counted out piles on the Mayo stand. Usually 2 or 3 piles of 10 sponges are used to start. At our clinic, we put 20 sponges in each pack.